Honored and humbled to be part of tonight's discussion alongside our illustrious Prime Minister, as well as my esteemed colleagues in the Ministries of Finance and Tourism. The focus of my presentation tonight is the continued rollout of the COVID-19 vaccine, the Oxford AstraZeneca vaccine, in response to the coronavirus pandemic, subsequent to the successful national launch on Monday, the 22nd February 2021, which aligns with the theme mentioned by Prime Minister, COVID-19, St Kitts and Nevis on the path to recovery. With our goals being to mitigate outbreaks and transmission of the virus, to protect the vulnerable populations, especially the seriously ill, and to minimize the impact of the pandemic on our health and socio-economic systems. The Ministry of Health is indeed very optimistic that these goals can be achieved with the support of citizens. It would be remiss at this time if I do not publicly commend all our residents and citizens who have been complying with the non-pharmaceutical protocols of meticulous and frequent hand washing, respiratory hygiene, wearing of masks, and physical and social distancing, which have been advocated by our healthcare team to combat the virus. Thank you for your enduring power as the Federation combats and awaited a safe vaccine. We expect, however, that you will continue with the protocols until you are advised of any relaxation. In addition, I must commend the staff of the Ministry of Health, particularly the members of the Health Emergency Operating Center, HEOC, nurses and doctors, and other frontline health workers for their expertise, dedication, and commitment in managing the virus thus far. I thank you sincerely. It is clear that our Federation has done well in combating the virus, with only 41 confirmed cases of COVID-19, one active case at this time, no death, and no community spread. But ladies and gentlemen, the fight is not over. The battle is still raging. We have to turn the corner. And with the statistics revealing approximately 50 million persons in the Americas are infected with the virus, it is imperative that we protect ourselves, our families, and certainly our beloved Federation. I am very pleased at this juncture, therefore, to assure the populace of St Kitts and Nevis, that our health system have been prepared for the quality rollout of the COVID-19 vaccine. But of course, having spent over $14 million in resources, we expect no less. In fact, within the Federation, we have already a best practice mechanism, the National Immunization Program of St Kitts and Nevis, with over 96% immunization rate, which is the envy of many countries. It is upon this existing, tested, proven, and good governance system that our COVID-19 vaccine plan is based for the effective administration of vaccines to citizens within the stipulated age group of 18 to 80. The program includes vaccine procurement, storage and distribution, and administration under validated cold chain conditions, as well as regular immunization training of designated staff. Undoubtedly, vaccine is not a new concept to our country, and one can conclude with a federal childhood immunization rate of over 96%, our citizens are accustomed to vaccination. It is well known that through the power of vaccines, Our region has eliminated smallpox, polio, rubella, and measles. With COVID-19, it will be no different. Safe and effective vaccines will help us turn the tide of this pandemic, but only if we can reach a large number of our population, no matter where they are, no matter where they live. And we will still need to establish and maintain public health measures of testing, contact tracing, quarantine, physical distancing, hand hygiene, and masks until the pandemic recedes. So, fellow citizens, we now have the COVID-19 vaccine, the Oxford AstraZeneca Covishield, which we are rolling out. And yes, it is free of cost. Although there were considerable investments, $250,000 to transport it to the Caribbean. We presently have approximately 19,000 doses of the vaccine in our central store, and we expect to receive additional amounts, at least 21,000 doses, through our procurement from the COVAX facility, the global mechanism working to ensure equitable access, which I am informed we will receive in the next few weeks. In addition, the ministry is exploring other avenues to access safe vaccines. It is important to note that the role of our public health system is to mitigate against morbidity and mortality caused by infectious disease at the population level, and vaccination does that. And St Kitts and Nevis continues to partner closely with our regional partners, CARFA and PAHO, to ensure our efficient rollout. Our vaccination plan therefore includes a comprehensive, robust communication strategy to guide the education campaign to inform the public and generate the expected demand for the vaccine. No doubt you would have noticed that such a campaign has commenced, utilizing traditional and digital media to disseminate the relevant content. There are many awareness education sessions. You saw the large gathering at Was University last week with a broad cross-section of entities, and the ministry is continuing to educate actively and aggressively within the community with effective facilitators such as the CMO and Chief of Staff, doctors, and other members of the ministry's health promotion team. In fact, my presentation tonight is an element of this strategy. I will now briefly describe the process of vaccination. We are presently offering the COVID-19 Oxford AstraZeneca vaccine at the Newtown, Bastille, Tabernacle, Sandy Point, Old Road, St. Paul's, Keon health centers this week at 1 p.m. daily, Monday to Friday. Commencing at 1 p.m. is a strategy to ensure that all public health services are provided during the morning period, and there is focus on the COVID-19 vaccine administration during the afternoon. As such, the ministry is encouraging persons who are interested in the vaccination to go to the nearest health center and make an appointment for the vaccination. In fact, by next week, we will be building out the vaccination at all the health centers, all 11 health centers in St. Kitts. So just walk in, be vaccinated, or make an appointment to do so. I remind you that the vaccine is free of cost. Persons are expected to complete a checklist prior to receiving the vaccine to ensure they are fit for the vaccine and to provide data for tracking the vaccination administration. The COVID-19 Oxford AstraZeneca vaccine is administered by medical professionals as an injection of 0.5 mils into the deltoid muscle of the upper arm as 2 doses. The second dose is given 10 weeks after having the first dose. And it is important to return for the second dose to complete the vaccination process. The vaccine will not be given if the individual is allergic to any ingredients in the vaccine, and like any other drug, a history of allergic reaction to any other vaccine or therapies must be reported to the healthcare provider. Pregnant women and lactating moms are excluded from the vaccine. After vaccination, persons are asked to wait 15 minutes to monitor for the occurrence of any immediate adverse reactions, and the vaccination record card or certificate would be stamped and issued to the person and should be secured safely by the individual. On receipt of the vaccine, each person is given a list of possible post-vaccination side effects to look for and a contact number to call to report side effects as they occur. Therefore, I submit that the process is seamless, and I can assure the public that all relevant logistics and storage chains are in place for the vaccine, as well as an established mechanism to track and trace all doses of the vaccine as they move through the system. Of course, you are aware the ministry has already augmented its staffing with the input of staff from Cuba. And at this time, I am very pleased to indicate that in our further quest to bolster the human resource component of the vaccine rollout, several of our patriotic retired community nurses have come forward to assist in the vaccination rollout. I use this forum to urge others to come forward as we engage in our mass vaccination exercise. I am also pleased to inform that there are adequate amounts of syringes and needles to administer the vaccine. In conclusion, I wish to assure the population that the COVID-19 vaccine safety surveillance and pharmacovigilance mechanisms are central to our vaccination rollout. The safety of the vaccines and consumers is also paramount to the Ministry of Health. The vaccine was developed by a reputable entity with history of safe vaccine, so there is much confidence in the safety of the vaccine. So don't hesitate, vaccinate. It is your right, however, to ask. In fact, we do have a high literacy rate, so we expect citizens to ask questions and perhaps be somewhat hesitant. Nonetheless, I trust you to follow the science and be informed by the data. The statistical data are showing that it is a good thing to be vaccinated. And I am sure you are aware from global statistics that with the vaccination, there are now significant decreases in COVID-19 illnesses, hospitalization, and death. Isn't this a good thing? Citizens, no one is safe until everyone is safe. I wish to commend all who have taken their vaccines thus far. Thank you for your keen and enthusiastic sense of safety and protection of self and country. And for those who have not, while you may hesitate just a bit, do not prolong your wait. Vaccinate. It is not a rush for the vaccine, but an urgency to save life. I urge you to disabuse yourself of the false sense of security and make vaccination a priority. Thank you.